Alright, she's about to remove my lovely white cover. And then she's going to unclamp my line. She's going to sterile her hands after. So,
Ready?
yeah. This is what it looks like with removing. Oh, we have to be careful with the line because it's longer. So, this morning it was like slippery. This is the reveal of the line. That little part.
This is what it looks like.
Yeah, there's that clamp I was talking about. It's a little longer so I can do it by myself. But tonight she's going to do it. Here, put that back. Unclip, clip it back. And then unclip it. I didn't get it. She's going to redo it. Now she's going to unclamp it for me. Again.
Right now the line is pinched off so that no air can get into it when it's not in use. And all you do is push it and it's open.
See?
And then there's a second part.
I had to have her do this today because I got frustrated because I'm righty, not lefty. So she's going to do this. No, I'm not too sure how she does this one because it's hard to see. If you have to, you can just take the gloves off and you just have to re-sterile those gloves. No.
Okay.
And that's the clamp. That's the clamp 2.
Yeah.
Clamp number 2. That's the original clamp. Because that clear line is an extended.
Mm-hmm.
So that way I would be able to do it myself.
And apparently she kind of likes doing it by herself. Because I had to beg her to get me to do it.
It's intriguing. Well, the unclamping and stuff, I gave up. So she's the one that's going to be doing that part. But I'm going to be doing my treatment in the morning and
basically all I did was it's like a pinchy thing to clamp it, and then to unclamp it you just unpinch it. So
yeah, I believe her.
okay,
now she needs to get the gloves on and hold that line. Because I gotta get down here. I can't afford to have it touch the ground.
yes. Although with the cap on,
Yeah.
probably not gonna make it bad or anything. But
Hold my lovely ports. Well, why do I say port all the time?
because I have a port.
That's right.
You're not used to this yet.
No. So my pick. There's the cap. The pretty orange cap. I'm not sure why she said it was orange again. Do you?
She didn't say, but she had the orange caps already.
Oh, yeah.
with her. So she was like, "Oh, okay, this is orange, so it's gonna stay orange instead of."
Oh, yeah, that's right. Because in the hospital, my cap was orange when they put it in.
Yeah.
I think there's different colors of clamps.
I think there's purple and blue,
I wanted the blue.
maybe white.
But I got orange. It's like, looks kind of neon, but it's not really that bright. Right? It's not that bright of an orange.
Kinda.
It looks bright because of the lighting.
Oh yeah.
So, this is a little while process to get prepared.
Yep. Want to make sure everything's as clean and sterile as possible. So that just decreases the percentage of infection that could potentially happen.
Yeah.
But it's not going to happen because
Yeah.
we are doing everything that we possibly can.
You want to talk a little about the EpiPen? You know more than that.
Oh, okay. When the nurse came by yesterday with all her stuff, she was given an EpiPen for the very first time. And she, basically all that is for is if for some reason she starts having a allergic reaction to this antibiotic, as far as it making her not be able to breathe or like swelling and just things like that, then she would use the EpiPen, and then she would go to the hospital, to the ER, so that she could get further treatment to help the reaction go away. But the EpiPen is basically just, it gives her more time to be able to be treated and seen.
And then we have to call my nurse.
Yeah. And when we have to use if we ever have to use the EpiPen, we not only have to call the ambulance or go to the emergency room, but we have to call her nurse that came out yesterday so that she can be aware of everything that is happening and keep track of how things are going with treatment, because she likes to keep very close watch on her patients, especially with Lyme disease.
I'm gonna pause it now.
Huh?
I'm gonna pause it now. So we're gonna pause it, and then we're gonna go to actual doing the treatment now. Okay. She's gonna put the saline on my line, so we can flush it.
You push and twist. Make sure it's really tight on there.
You have to get the air bubbles out first. That's what not to do.
Oops.
She was just showing you what not to do.
You would think I've had so many of these, and yet I have no idea what to do.
You just wanted to get it going.
Very, very important. You have to get the air bubble out. It's up the top. And so what you do is you just,
Pull back and then let it out.
yeah. Because that air bubble just popped up in the...
See, that's what she did. She showed you all first.
Yep.
And then she's going to
And all
make
you
sure
do
the
is
air's out.
You pull back a little bit. Get some air in there. And then you push it up all the way to the very top to where it's almost coming out.
There.
There it is, right there. It's at the very end of the line.
Here, let a little come out. That way they can see. There you go. See? She got that air bubble out.
Yep.
Now she's going to do this.
Clamp it. We put it on the line. And you just push
Twist.
and twist.
She isn't going to twist it as to the point where she can't get it off. She's twisting it to where she still can get it off, but it's tight enough. So if it...
Yeah, so there's no air that leaks
Yeah.
around the opening. And then...
Now she's going to...
Ready?
Yeah. She's going to get that liquid, the saline to go in. And I can feel it. Feels pretty weird. Don't have the taste like most people have, though. I have the smell. I can smell it, though.
Yeah, I can too. When I have it, that's what I do. That's what happens to me is I smell it.
It's like really what, bitter smell? It's like smells, I don't know how to define it. It's very strong.
It's saline to me.
It's like bitter. Like, it's kind of like worse than hand sanitizer smell to me. But I have a very sensitive smell, and everything's sensitive now.
Okay.
So she got that done.
And then we just twist it the other way and pull it off. And here we go.
Round 1. Okay, now this is the actual medicine part. See the little red clamp?
Looks like a graduation hat.
Yeah, it does.
Looks red.
Now this is going to be a little tricky because air, even when you get the air out, there's sometimes air that comes in. So you have to make sure you recheck before you insert it into the clamp thing, the injection part. So yeah, she's being careful more because we don't want any really meds out. I think you got the pull out.
Okay, and then you just do the same thing.
Now this meds kind of makes me really weak and tired and have pain and sometimes some breathing problems, but not yet to the point where I have to go use my EpiPen.
And this has to be ran over the course of about 4 minutes.
Which I will grab her phone to time it.
And that's basically one line per 30 seconds.
Yep.
Yes. Every 30 seconds you push to the next line, basically.
12 minutes already. Okay, so I got her trusty phone and the stopwatch. I'm going to start it when she says ready.
Go.
And I'll tell her when the 30 seconds are up because it's kind of tricky to do it by yourself. But I did pretty well.
You did.
Now on this meds, I can taste it. It's really nasty. But I haven't really had an appetite, so. But that's okay. We just gotta make sure I get protein in me. Now. That's what the nurse is wanting us to focus on is protein.
Yep.
Because that's people with Lyme, we don't really eat that much, and with this meds, it's gonna hurt my appetite more.
Probably. Yeah.
Like right now, with it just now going, I can feel my stomach hurting bad. Pain. Yeah. My head. So the difference with me on meds is I could already feel the symptoms and stuff, and it doesn't really make you have an appetite, or it just hurts a lot.
Yeah.
Feels like an explosion. Go. It's like it feels like it's kind of like that bloated feeling, but it's not, and it feels like it's hard a little. So it's good. Tuesday, I have to do lab work, and I have to go do a UA to keep track of my urine and all the stuff, my kidneys and everything, basically.
Mm-hmm.
We're on 2 minutes so far. She's doing awesome.
And for anybody that doesn't know, a quick little fact about PICC lines is it goes through your arm, but it goes all the way up and kind of over, and it goes directly into your heart.
Yep. That's why my heart races after treatment. We need to. Oh, go. My bad.
It's okay.
It isn't that far after.
Oh, that's fine.
Well, talking is a distraction, but we're good. We're doing good
we're
though.
We're doing good.
It's gonna. Usually, it takes the people a little while to get used to it. So.
Yeah, this is not an exact science, people.
See, we can. It's a good thing we've been friends for so long because I trust her to do this, and she knows when I point at her what it means instead of, huh?
Yeah.
So, but it really causes a lot of pain to your stomach.
And it's made you really weak too.
Yeah, it's new, difficult, but hopefully I stay okay on this. If not, then I'm on drug number 2, which is going to be harder and more of a risk of having allergic reactions. So far, we just hope it stays a little minor like it has been.
Almost done. One more.
We got one more to do, so it'll be about 4 minutes and 30 seconds that it's taken.
Which is pretty much perfect.
Mm-hmm. The feeling is like getting kicked in your stomach. See, she's about done.
All done. You want to make sure that you push it all the way so that there's no air. And all the medicine gets in there.
Yep. So, we'll pause this.
Mm-hmm.
Okay, so she is going to clean the line. You'll have to open it. She's gonna
Make sure that it stays really clean and sterile. Clean it with an alcohol pad.
my lovely line. I have my little mark still from yesterday.
Yeah.
She's getting it clean for 15 seconds. I think we need to talk to Dr. Christ about the pain in my stomach. Making it all pretty and clean.
Oh yeah.
And then I will hand her the saline to flush the medicine. If that went in. I can't do it. Alright, she's going to do a repeat of getting the air out of the saline.
And the reason you do the second flush after the antibiotic is just to make sure that the line is clear and that the medicine gets all the way into her blood so that it can work.
So,
Coming out a little bit so we know that the air is completely out. So now
we
repeat.
twist and shout. Oh.
Push and twist. Make sure it's a little bit tight so that the air doesn't get in. And then we just finish.
She's doing the technique that the nurse taught us. Is it working? Oh, okay. I was gonna be like, uh-oh. No, it's working.
Yep, it's working great.
Basically push it with your thumb so it could go in.
Yep, and you do it a little bit at a time, and that helps prevent blood clots as well as
Mm-hmm.
the heparin that we are about to do in a minute.
I'm on a higher dose of heparin because of the way my blood clots. So,
And I was thinking about it last night. I bet the reason why you are on the stronger dose of heparin is because your blood is so thick.
yeah.
Because of the Lyme bacteria, it makes her blood really thick, and so they want her to be on the higher dose of the heparin so that hopefully it can prevent blood clots and thin out her blood a little bit, so it's not like sludge. Because that's what's pretty much like right now, sludge.
Ta-da!
And then we just twist it off, and that's done.
So, this is the heparin. She's pretty. She's going to, yeah, on the, it's kind of yellow. This is, like she said, to prevent blood clots. So, it's awesome. And that would be my last thing, except to put a brand new clamp on, which I'll give her after she gets done with this. And she'll show you how to reclamp it. Alright.
We do the same thing with the heparin as we do with all the others. Pull back a little bit, maybe.
Yeah, you gotta have like more of a strength.
Oh, that's the end of it.
Oh, so just pull up, I guess. The heparin's smaller than the rest.
Yeah. So basically, you don't need to pull back at all, but there is a little air bubble, so you just gotta push it up a little bit.
Just gonna make that air bubble drop. That's a feisty one. See that air bubbles? Okay, she's going to do the twist. There. Dang. It's a fighter.
I was afraid of that.
I think it's out there. I think I got that.
I hope so.
Well, she just wanted some heparin, I guess. Okay, here. Oh, it hurts to laugh. Ah. Okay. Who said doing moans is not entertaining? That was a fighter, though.
That bubble was like stuck
I know.
on the top.
These little things have issues.
Yes, they do.
Okay, now here she goes. She has heparin on her hand.
Yep. The hazards of doing IV medicines.
Now the heparin's going in the line. It's right there. Put y'all sideways. She's plunging.
Yep. Ta-da!
All done. Now the last step.
40 something there, right?
So this is the cap. It's orange. And I will take this off, but she will be handling it because her hands are still she's sterile and I'm not. here she gets the little piece. So what she does is she puts that on top.
Get it in the center.
And then twist. Yeah, you gotta push hard and then it twists and it snaps in place.
So sorry.
There we go. Yeah. So we are done. We got the cap, and all we have to do is put it all under the cover. So, how was it?
Pretty good. For my first time, yeah, pretty good.
Alrighty, we'll see you later.